Hey, it's Friday. It's TGIF Doc Talk with Dr. Go. Click the share button to share this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.
Hi everyone, and welcome to another episode of Doc Talk. And today we'll be talking about one of the very common issues affecting seniors, which is joint pain, also known as arthritis. And today's podcast will be divided into three main parts. The first part of this podcast, I will talk about the most common causes. The second part of this podcast, we'll be talking about how can we prevent arthritis from happening or prevent it from getting worse. And the third part of this podcast, we'll talk about how can we actually apply treatment and what are the steps of treatment that will be undertaken to solve the issue. Now we'll start off with the most common causes. Now, joint pain in the elderly can result from a variety of conditions and also age-related degenerative changes of the body. But a large majority of the elderly actually suffer from joint pain, usually at the knees or the hips or the elbows. A very, very large percentage of them actually suffers from osteoarthritis. Now, what is osteoarthritis? It's basically a degeneration of the joint cartilage over time and the development of what we call bony spurs within the joints itself. And it causes a lot of friction. Sometimes it might even affect the nerves or the tissues. And it often affects knees, your hips, and also spine. And what it causes is the joint will feel like it's very stiff. It feels like very limited range of motion. And it also can be quite painful. And typically when you move that joint, you will hear some crepitus sounds within the joint itself. This is actually the most common cause of joint pain in the elderly, and a large majority of elderly actually suffers from this, especially when they cross 70 years old. And other causes of arthritis, which is quite relatively rare compared to osteoarthritis, is rheumatoid arthritis. And rheumatoid arthritis is an autoimmune disease, meaning to say that the body attacks itself. And it can actually affect people of any age, but the symptoms may actually worsen with age. So maybe this person might have rheumatoid arthritis at maybe about 40 to 50, but due to the long-standing arthritis and bone degeneration, the severe symptoms only manifest at a later age. And the typical signs of rheumatoid arthritis is symmetrical joint pain, where it affects both sides, not only one side, the left side, it affects both sides equally. And the third common cause of joint pain is usually caused by gout. And gout is due to a buildup of uric acid crystals in the joints. And this one usually it affects the big toe or any other joint as well. And the symptoms is that it's usually very sudden, intense pain with redness and swelling. Now, for the purpose of this podcast, we'll be focusing more on the first type, which is the osteoarthritis, the most common cause, and is due to degeneration of the joint tissues, cartilages, and it causes stiffness, pain, and limited range of motion. And we'll go into the second part of this podcast, which is how can we actually prevent this kind of arthritis from happening. Now, I will usually advise the seniors on three main things. Now, the first thing is to actually stay active with low impact exercises. Now, the kind of low impact exercises are exercises which does not give a lot of strain onto the joints. For example, lightweight walking, very simple walking, and also with good shoes and not too strenuous running. You can also look at swimming or cycling to keep the joints flexible and mobile without causing too much excessive strain onto the joints. What's also quite important is to do stretching and also things like yoga or Pilates, where you can actually enhance the flexibility of the joint and also reduce the stiffness without compromising or adding more stress onto the joint itself. And thirdly, of course, is strength training, where you lift weights The purpose of this weightlifting actually is to build up the muscle around the joints and to improve the stability, and it really helps with reducing pain. So staying active with low impact exercises is top of the list in terms of how we can actually prevent joint pains from getting worse with age. The second most important prevention tip is to actually maintain a healthy weight, because excessive weight puts a lot of pressure on joints, particularly the knees, the hips and the back. So for an obese individual, it's almost a good 99% chance that they will develop osteoarthritis when they are old. Whereas if this person is lightweight and much more slimmer, the chances is much less. So also having a good and balanced diet and also regular activities help to maintain or slow down the degeneration of the joints, the cartilages, and it helps to reduce inflammation as well. So maintaining a healthy weight and a healthy diet is very, very important. And of course, the third one is to use joint-friendly mobility tools. So for example, like a cane or walker or grab bars, it can actually help to aid mobility. So you wouldn't put excessive weight onto one particular joint, and it also helps to prevent falls. So those are the three main tips that I have to prevent or reduce the chances of developing arthritis. Now we go to the third part and the final part of this podcast, which is about treatment. So if you already have this kind of arthritis, now what can you do? Let's just use knee osteoarthritis as a good example. So probably an 80-year-old man has chronic or long-term pain over both knees, and whenever he starts walking, he feels very pain and stiff, and sometimes it's warm and just so painful. So what this person can do is, whenever he feels such pain, he can actually apply cold packs. So cold packs around the joint area, and cold packs basically is like ice packs you place onto the joint itself, and it helps to reduce inflammation and reduce pain. And at the same time, we can also look into having a physiotherapist to come in and have personalized exercises for the elderly to improve the joint strength and also the muscles surrounding that joint, and also improve the flexibility of the ligaments so that the joint would be more stable and stronger, and this actually helps to reduce pain. Now, with regards to treatment, unfortunately, if the osteoarthritis is already quite severe for that particular elderly for both legs, you have 3 steps of treatment, right? For very mild cases, usually what we suggest is to take some pain medications to reduce pain and inflammation. Some medical doctors might also recommend the use of glucosamine to help the joint tissues to get better. If that doesn't work, the next step would be to go for intra-articular injections. So you will see an orthopedic surgeon and they will give some injections into the joint, and this will help to reduce the pain over that joint probably for about 2 to 3 months. And if that also doesn't work, then the final step would be to opt for replacement of the joint. It could be a total knee replacement or total hip replacement or something along those lines. So all in all, to summarize things, joint pain in the elderly basically can result from a variety of conditions, and the most common cause is osteoarthritis. Prevention is basically lifestyle related. Maintaining a very healthy weight, don't be too obese, and also a healthy diet is very important. Stay active with low impact exercises, walking, swimming, cycling, stretching, and also Pilates or yoga. Those are very important. And also to use joint friendly tools if you are not completely mobile on both legs. For treatment wise, there are 3 levels. The mild one is to take pain medications. If that doesn't work, intra-articular injections. And if that still doesn't work and it actually compromises a lot of your lifestyle, you may consider doing a joint replacement. So that's all for today, and thank you for listening, and have a good evening. If you like this podcast, please do not forget to like, share, and follow us. Thank you.